Increased Rate of Cardiovascular Events in the United States by Irene Cummins, Jasmine Btzer, Sarah Tankerslev, and Angela Slarb. Cardiovascular disease is the leading cause of death in both the United States and worldwide. It is expected that 40.5% of the United States population will have some form of cardiovascular disease by 2030. The average cost for treatment in the United States per year is $71 billion.
The increase of cardiovascular events in the United States has many variables. That includes health risks that are where the patients are smokers, high BMIs or obesity, diabetes, hypertension, a history of cardiac vascular disease, or heart failure. Depression, stress, lack of medical insurance, not being compliant, lack of physical activity, poor diet consumption, no primary care follow-up. There's a social disadvantage to people that grow up poor and in lack of education. This leads to a chain of events that causes early disease and early death.
Congestive heart failure is the inability of the heart to pump enough blood to meet tissue requirements of oxygen, resulting in the decreased cardiac output and decreased tissue perfusion. Atherosclerosis, the major precursor of cardiovascular disease, can begin in childhood with children as young as age 7 to 9 with lesions in the aortas and right coronary arteries.
Convenience, not always best. When looking at the causes for increased risks of cardiovascular events within the United States, we mentioned diet and diabetes. We're noticing a trend with an increase of convenience stores located around the country. These stores are convenient, but they offer low health quality snacks. They tend to be more abundant in low income areas. The snacks are typically full of artificial sweeteners, processed meats. They tend to be desserts or salty treats. Going along with this, diabetes increases the risk of cardiovascular events by 2 to 3 folds. Fluctuating glucose can cause damage to the epithelial cells and even cause cellular death within the cardiac system. Additionally, the glomerular filtration rate for CKD patients also plays a key role. There has also been found to be a link between depression and heart disease. In one research study, over 1/3 of participants with depression later developed some form of cardiovascular disease. There is also a higher rate of smoking, alcohol abuse, and obesity within depressed patients. Oftentimes, this includes women who are middle-aged, divorced. They tend to involve themselves in more high-risk behaviors. Smoking increases the risk of cardiovascular events. The effects of vaping are unknown at this time, and this commonly seems to be in that age group of 40 to 50, the middle age group that I spoke of earlier. That's usually the age where they're going through the divorce, they're feeling poorly about themselves, so they begin smoking, drinking, not watching what they eat, not exercising like they should be. All of this leads to an increase in risk.
Cardiovascular disease signs and symptoms. They may vary according to the medical diagnosis. The most common ones are chest pain or discomfort. You'll want to assess the quality of the pain, 0 to 10. Have them describe characteristics of it. Does it radiate? Is there discomfort in other areas related to it? The duration of the pain, what aggravates it, or what relieves it. Have them describe the pain. Is it aching? Is there pressure? Is it dull? Is it sharp? Does the pain cause nausea? Any shortness of breath? Are they fatigued or exhausted? Do they feel irritable? Are they having sleep disturbances or anxiety? Is there edema, weight gain, abdominal distension? Do they feel dizzy or have syncope? Are there changes in their level of consciousness? You're going to observe their skin condition. Is it pallor? Is there cyanosis? Do they have an increase in bruising? Do they have any thinning skin around the heart? This could be an indication that a device such as a pacemaker or a defibrillator may be eroding. How does their skin feel? Is it cool, cold, moist? Is it warm? There's additional information in the notes section that you can look at.
Here are some examples of different laboratory and non-invasive cardiovascular tests. These tests are beneficial since the results may provide more in-depth detail of what is actually going on with the cardiovascular system, especially the heart. An EKG can show if a patient has had a heart attack or if their heart is not in regular rhythm. A chest X-ray can show if a patient is in congestive heart failure. And the BNP blood test can be an indicator that a patient is in heart failure if the results are high. There are several different options for cardiovascular treatment with medications. The physician's choice of medication will depend on the circumstances of the cardiovascular condition. If an individual has a history of blood clots, then a long-term anticoagulant may be prescribed. If an individual has an elevated blood pressure and heart rate, then a beta blocker may be more appropriate. If their blood pressure is elevated but their heart rate isn't, then they may be prescribed an ACE inhibitor or a calcium channel blocker. These are a few different drug classes of cardiovascular medications. Cardiovascular events or diseases can be prevented by promoting a healthy lifestyle and can also avoid the development of other comorbidities. Some examples of prevention are exercising and maintaining a healthy weight, eating a well-balanced diet, and avoiding smoking and large consumptions of alcohol. Also, seeing your doctor for a yearly health and wellness checkup will be beneficial in the long run.
Our plan for a brighter future starts with a seed of knowledge. The increase of cardiovascular events over the years continues to grow. Kids are being diagnosed with diabetes at a younger age. Obesity in the U.S. is continuing to grow as well. Kids are having heart attacks. An active plan needs to be put into action to prevent cardiovascular disease at a younger age. Our plan for this is to implement mandatory school education, require middle school health classes nationally, provide education for cardiovascular disease prevention. We would like to test random schools in poor communities. In order to do that, we would have the schools provide an area of land where they will grow and take care of fresh fruits and vegetables. We will educate their parents to help their kids make better choices. The kids will harvest their fruits and vegetables and be able to take them home to eat. In health class, they will also teach them how to access simple recipes. And they will also learn simple exercises that don't require a gym, that teach weight resistance, stretching, and relaxation skills. Once the kids reach high school, they will be offered an elective class that can be taken to continue to learn advanced gardening skills, increased exercises, and nutrition. They will be provided seeds so that they can have small gardens at home, in their yard, or in planters. We will evaluate the kids that participated in these to see if they have a better understanding. The percent of kids that continue to grow their own foods, the percent that exercise or cope with stress better. And we will evaluate the change in long-term cardiovascular disease within these kids that have been educated and have had opportunities. If this works, we will implement a national program so that all schools across the United States will participate in having gardens and allowing the kids to grow their own foods and make healthier choices. If this doesn't work, we'll reevaluate the plan.
In conclusion, we can make a difference as nurses. We can lead by example by maintaining healthy lifestyles ourselves. Be proactive for your patients. Teach them how they can change their own lifestyles. Help them come up with resources in order to make those changes happen. Be an advocate for them. If they're unable to afford fresh fruits and vegetables, help them find a program to assist them. Teach them how they can safely exercise in order to lower their cardiovascular risk.